Hi, this is Dr. Johnny Truong. I would like to share with you about some of the common things that we think about when it comes to car accidents. First off, most of our society is conditioned to think that when we are involved in a serious car accident, that until we develop serious problems like neck pain, back pain, then we go see our chiropractor. But really, in reality, whenever you have a car accident, even a car accident that's low impact, like a 7-mile-per-hour accident, can cause the lower part of the neck to weaken, and it allows parts of the lower part of the brain to herniate into this brainstem area and occupy space in that area. So when you have a car accident, really you should get your neck checked right away, especially if you have one of those incidents where you get hit from behind and your neck, gets whipped back like this and then forward, snaps forward and back. And what happens there is that the neck then becomes unstable, and it can lead to potential neck pain or back pain as a result of this injury. But also, maybe you might not feel the symptoms right away, but you can actually feel the symptoms later on. And the typical car accident takes about anywhere from 3 to 4 years to manifest. So high impact incidences, car accidents, can definitely lead to serious chronic conditions. One good example is my mother-in-law. She had a really serious car accident in 1989 in Los Angeles, and her husband was in the vehicle with her, and there was this car that T-boned their car at a really high rate of speed. And after that accident, her husband went into a coma and was in that coma for 7 months, and then eventually died from it. So it was a really serious accident. She survived the accident. However, she had chronic migraine headaches. She had difficulty with breathing. In fact, she would need an oxygen tank to breathe from, because the breathing was so compromised from that accident. And so when I met her in 2001, which was about 12 years later, I gave her an upper cervical adjustment, cleared this nerve interference out, and sure enough, she had tremendous results from that, and she was able to, not have to breathe from an oxygen tank anymore. She's actually breathing very well. Her asthma went away. Her headaches definitely went away as well after that, the correction. So certainly, if you have been involved in a high impact incident, make sure to get your neck checked. Also, there are repetitive trauma incidents that we don't think much about. First of all, I see this a lot at airports when I go fly. I see people looking down at their smartphone and they're typing in their texts or whatnot, and that leads to what we call tech neck. So you're looking down, looking at your laptop, you're sitting on your bed and looking down at your laptop, and that strains your neck, and that over time compresses the disc in your neck, and that leads to all sorts of degenerative problems for your neck. So certainly, it's a good idea to get that neck checked. Especially, mind you have gravity that's working on your neck all the time. Especially your head weighs about anywhere from 10 to 14 pounds. That neck, is under a lot of pressure, and when you have repetitive trauma, like looking down, like looking to the right as you're typing, that could strain the neck as well. And lastly, with upper cervical chiropractic adjustments, it's a very tailor-made type of approach. It's not like your traditional chiropractic treatments where you come in, the doctor takes your neck and pops it one way, pops it the other way. This particular approach that I utilize, which is called the Blair upper cervical chiropractic technique, is we use a very customized form of X-rays. We use 3D X-rays to visually see how the bone has slipped out of alignment, because this particular atlas, the top bone in your neck, actually has 251 variations of how it goes out of alignment. So without the proper X-rays, without the proper imaging, you're going to get information that without the X-rays, you're not going to be able to see anything. You're shooting in the dark. So it's very important to get your neck checked, and especially utilizing the upper cervical approach or method. That I feel would be very beneficial to taking care of any type of car accident injuries. So for now, I'm signing off. Thank you for listening to this video, and please read my blog about accidents, and look forward to sharing with you other videos in the future. Take care. My name is Dr. Johnny Truong, and my office phone number is area code 213-385-3858. Thank you.